Now, let's read about the necrosis and the different morphological types of necrosis with example. This question was asked in July 2015 and September 2022. Now, looking at the definition of necrosis. Localized area of death of tissue followed later by degradation of tissue by hydrolytic enzymes liberated from dead cells. Later inflammatory reaction occurs. This means there is a local death of tissues where there is destruction of the cells. That is called necrosis. There are 5 types of necrosis based on the morphology. The first one is coagulative necrosis, liquefaction necrosis, gaseous necrosis, fat necrosis, and fibrinoid necrosis. The first one is coagulative necrosis, which is the most common type. Now, it causes irreversible focal injury, sudden cessation of blood flow, bacterial or fungal infections. Organs affected are kidney, heart, and spleen. Grossly, infarct, that is in the initial stage, the affected areas early is firm, pale, and slightly swollen. But later, when we see, it is more yellowish, softer, and shrunken. Microscopically, the normal cell, it is called is tombstones. That is, cell outline is retained. Later, the swollen cell and more eosinophilic cytoplasm is seen. Cell digestion and liquefaction fails here. Therefore, it is called as coagulative. Then dead cells are phagocytosed by granular debris. Moving on to the second type, that is liquefactive necrosis. It causes ischemic injury, bacterial or fungal injury, hydrolytic enzymes. Grossly, when we see, the liquefied center is seen and a cyst wall is formed. Microscopically, cyst space have necrotic debris and macrophages. Cyst wall is formed even in microscopically view. The cyst wall has 2 types, that is proliferating capillaries and proliferating fibroblasts. The proliferating capillaries are seen in the case of brain and the proliferating fibroblasts are seen in the case of abscess cavity. The third type is caseous necrosis. It is found in the tuberculous center of foci, which has both the characteristic features of coagulative and liquefactive necrosis. Then when you look into grossly, the lungs, it is usually seen on the lungs. The foci resembles dry cheese, which is soft, granular, and yellowish in color. Then histotoxicity effect, it is since due to the Mycobacterium tuberculosis. Microscopically, when we see that it is structureless, eosinophilic, and scattered granular debris are seen. We can see granulomatous inflammatory reaction. Moving on to the fourth type, that is fat necrosis. In fat necrosis, the fat-rich anatomic location in the body, example the breast and acute pancreatitis will be seen there. Grossly, it is yellowish white and microscopically it appears cloudy appearance and inflammatory reactions are seen. Now this is the last type, that is the fibrinoid necrosis, that is deposition of fibrin-like material. Now staining properties, that is phosphotungstic acid hematoxylin, that is PTAH stain. Example autoimmune vasculitis, autoimmune disease, arthritis reaction, peptic ulcer, arterioles hypertension. Microscopically when we see it, we can see brightly eosinophilic and hyaline-like vessel wall is seen. So that's what about the necrosis. Hope you like the video. Thank you.